When a new therapist is going to graduate and get started entering a traveling career, it's really important for them to collaborate with their recruiter about their strategies and to make sure to be as flexible and open, and just communication is the key with their recruiter, so that we can make sure that we're matching their professional goals and their personal goals and helping them achieve everything they would want to get out of traveling. Right out of school, it's so important that you get that experience, and so being flexible and open-minded about things that you may not have ever thought of would be a really good quality for a new graduate.
New graduates are some of my favorite clients to serve. A part of it is because they really do need someone to help educate them and kind of walk them through day by day of how things work, but they're always so open-minded and so energetic and so receptive to feedback, and that's the kind of relationship that you need. I have to be that way in order to help them. I have to listen, and I have to get bought into what they're trying to accomplish.
The biggest perk most of all is that their resume is just beefed up so much. So if a person graduates from college and goes and works at a skilled nursing facility for 5 years, they really don't stand much of a chance of getting a job over a traveler who's just traveled for 3 years. Their resume is so diverse, they've been trained to hit the ground running no matter where they go. And so once a person does decide to go perm, they always end up finding the perfect job. And that's something that you can't do right out of college.
If you're in school now and you're considering which travel company to work for, one of the things that I suggest starting with is talking to someone from that company. The most important thing in regards to your traveling career is having a recruiter that you can trust and that you can partner with in coming up with a game plan, making sure that you're getting all of your questions answered, and getting them out there. I would encourage you to perhaps have a list of questions about entering the traveling career and getting on the phone and chatting with a recruiter about those questions. One of the advantages that Med Travelers does have, we have a new grad manual that you can also access on our website for newer grads entering the traveling career. Hopefully this can serve you with the purpose of assessing if traveling as a new grad is a right choice for you, but definitely get on the phone and talk to a recruiter, because they're the best people to chat with and have the knowledge of the industry overall.
The best piece of advice that I could give any new grad or anyone really considering going into traveling therapy: don't listen to the naysayers. Don't listen to the people that tell you that you can't do it. It might be your professor saying you need to get 1 year of post-grad experience before you do this, otherwise it's going to be hard for you. Unless that person went through that, and unless that person is you, that's not necessarily the case. So, don't let people deter you from doing it if it's something that truly speaks to what you want to do in your life. Those few years after college before you really settle down are such a vital opportunity to really get out there and learn more about yourself as a person and as a healthcare provider.